Just a little bit of background on this talk. I have presented this every year for the last 10 years. I usually do it in June because I look at summer solstice time as a time when we start to prepare for the difficulties that some people have more than others in the fall and the winter. This talk is called Boosting Respiratory and Immune Health, and we'll start with some comparisons, I guess, between medicines. There are many differences between the philosophies and thus the practice of different forms of medicine throughout the world. From the perspective of TCM, or traditional Chinese medicine, which is what I practice, one of the most profound differences is that way that we view illness, which is brought on by an external pathogen. This concept is roughly comparable to the Western concept of viruses and bacteria invading the body, though TCM provides another viewpoint on how colds, flus, and infections affect our bodies. These differences require a little more explanation. One view which might bridge that gap between worlds may be roughly described by the concept of biological terrain. This is a Western concept, but it's not exactly a TCM concept. Here is an excerpt from an article called Biological Terrain by Dr. Simon Yu, MD, which may help you bridge these differing viewpoints. Contrary to Pasteur's theory, the basic premise of holistic medicine and natural healing is that it's not germs that cause the disease, but rather the cellular environment of the body, referred to as the biological terrain. This becomes imbalanced, resulting in a disease condition. In this view, Streptococcus bacillus is not the cause of strep throat. Instead, a breakdown of our body's immune system I completely lost my place. Creates an environment for Streptococcus to transform into an infectious virulent form. The breakdown or suppression of our immune system is caused by a disturbance of our biological terrain. This disturbance results from a variety of causes, including stress, lack of sleep, poor rest, poor nutrition, and there are environmental factors. So through the correction of the underlying conditions, the body will heal itself by restoring its proper biological terrain. Brief summary of the TCM concept of biological terrain is that due to constitutional, lifestyle, dietary, environmental weaknesses, this is roughly equivalent to some genetic tendencies as well. The individual will become more or less tending towards respiratory illnesses such as asthma, chronic bronchitis, rhinitis, sinusitis, and chronic illnesses such as COPD, emphysema, and lung sarcoidosis. This may also include a tendency to more colds, flu, bacterial, and viral infections. We can improve upon our wellness and what Western medicine calls our immunity by taking the seasonal opportunity to boost the strength of lung and kidney meridians as a way to boost the body's immune response. The lung and kidney meridians are influenced by the seasonal changes, fall and winter, respectively. The lung meridian is more associated with fall and those energies, and kidney meridian with winter and the energies of winter. Those with deficiencies in these meridians may suffer more of the illnesses listed above. Those that have strong lung and kidney meridian qi may benefit from utilizing some of the following suggestions as well. I like to give people methods that they can use to take control of their health, both preventatively, starting at this time of summer solstice, and then continuing through the fall and winter seasons. I like that people are able to empower themselves to make differences in their own health. So, lifestyle habits and choices. We all know the basic no-nos when you're concerned with lung health. There's no need for me to remind you of these. But what if you feel you're already doing everything right and you're still challenged with respiratory illness and weakened immune response? One very simple technique to add to your lifestyle habits is to cover your neck and chest well, and to protect these sensitive areas from blasts of cold and wind. This sounds so simple, but really, scarves are an attractive and powerful way to achieve this. Hoods and hats protect the head, back of the neck, the upper shoulders. In TCM, we believe that wind assists the pathogen, whatever that pathogen is, to penetrate the Wei Qi, or the protective layer of our bodies. And so you protect yourself from these external factors. Also, do not sit in front of a cold draft, under a ceiling fan, or wind coming through a window. The combination of damp and cold wind can be particularly difficult for some individuals that are more susceptible to those elements. This is a concept that our grandparents and great-grandparents knew well, and that we have forgotten in modern society. Masks are the newest addition to our preventative lifestyle choices. Like it or not, they're here with us now. Yes, please wear a face mask. But I think this can be done more effectively. Masks protect the wearer and those around us. We still are not sure what our safe distance is. The acceptable answer to this is 6 foot of social distancing is acceptable, but there are many factors. Are you indoors? Are you outdoors? Are the droplets that you're being exposed to aerosolized, tiny droplets? Are they projected? Are you already carrying a significant viral load? Are you immunocompromised? And the length of time that you might be exposed to these pathogens in the air. So I'm going to try to break it down a little bit for you. We don't get this kind of education, and I think it's kind of important because we're wearing masks every day. Wear a mask that's appropriate to the situation. So I'm going to show you, this is an N95. This is an N95 that does not have the vent in it, okay? This kind of mask is great if it fits your face really well. But really, this is only necessary for those who are working in healthcare situations when they're exposed to these tiny aerosolized droplets that are being projected. They're being exposed at a very high level. And also the people that were in the wildfire situations really needed N95 masks. The masks that most of us use, and some are better than others, are either the disposable surgical mask, this one, you've probably seen these. There's a little wire at the top. You hook it over your ears, you tuck it down under your chin, but they have a little gap here, you know. The advantage of these is you can use a clean one every day. You dispose of it, and it's important to have a clean mask every day. So a lot of us are using these cloth masks, and some are homemade, and there's nothing wrong with homemade. But if it's cotton, I'm going to show you mine, okay? It basically fits around my face, but it's loose. And if it's cotton and you have at least 3 layers of cotton material And then this one, I'll show you here, has a pocket inside of it. You see? And that pocket that's on the inside of the mask, you can slip in a carbon filter. Right? This is a carbon filter that's in polyester material mask. This is an ear loop. Or, these are really effective. This is just a coffee filter, and you fold it and you put it into that pocket in your mask, right? And you change that out every time you get a new clean cotton mask. And it's important then to wash these. These are very washable. So then another mask, you can use I wanted to mention, you see people a lot of times with bandanas with gaiters that they just pull up from their neck around their face. Those forms of mask are the least effective. Now, it's better than no mask at all, but they're not terribly effective. So one thing I'm going to suggest too is take mask breaks. So safely move outside of the situation that you're in around people and take your mask off and breathe as long as you are no nearer than 30 foot from people. People who have to work with mask on every day, I hope they're taking mask breaks. A lot of employers are encouraging their people to do that. So that leads me to talking about breath work. And possibly a lot of you are already doing breath work, but I wanted to emphasize that breath is the essence of life. We work with breath when we practice meditation and Qigong. We are working with our Qi when we work with our breath. Breath work will build our Wei Qi defenses as well. Wei Qi, again, is our protective Qi. There are so many practices using breath. All may be beneficial to strengthening the lungs and the immune system. This tool is with us 24/7. It's free and it's always accessible. I think breath is the most amazing, miraculous thing we've been given. So I'm going to suggest 2 resources that myself and my patients have found very helpful. A book called Breath, A New Science of a Lost Art by James Nestor. He goes into a lot of explanation of the beauty of breath, as well as exercises. The Art of Breathing, 6 Simple Lessons to Improve Performance, Health, and Well-Being by Nancy Zhu. And this was recommended to me by one of my patients who has asthma, and she's completely been able to get away from her inhaler. I'll talk about her a little while later. She has really done a lot of different things. It's not just this, but she started doing these lessons and really was impressed with this book. So there are so many more options. This is just a sample of some of the books out there. A key focus with breathing is you want to deep breathe. You want to breathe deeply into your belly. You want to expand your belly first. Instead of shallow breathing, only goes to the upper lungs. So in deep breathing, you expand the belly first, then the lungs, as opposed to shallow breathing, which only extends into the upper lungs. When a patient is recovering from certain surgeries and illnesses, they're given a device called to help them practice breathing. It's called an incentive spirometer. Some of you may have used that before. And basically what that device is doing is in order to successfully use it, you have to exhale fully. And when you exhale fully, this descends your diaphragm. The diaphragm is below your lungs, and it allows more room for your lungs to expand. So the exhale becomes extremely helpful in how much air you can bring into your lungs. So as you exhale, and you then take long, slow inhalation breaths. Then as you do this over and over again, your lungs are exercised and they're allowed to expand further and further. And if you want some proof that this is actually happening, because I mean, you feel differently when you do this kind of long exhalation and a hold, and then a long, slow inhalation. But if you really want some feedback on that, you can use a pulse oximeter. A pulse oximeter tells you quickly, pretty quickly, what your baseline oxygen level is. And you're probably experiencing this at some doctor's offices, but it might give you, like mine's really low right now. I usually run 97, 98. But if I were to do this breathing exercise, I can guarantee you I would go up, because I practice this, I would go up to 97, 98 within about 3 inhalation exhalations. And so that's proof to me that it's really working. Not only that, another great advantage to increasing your lung capacity with breathing exercises is that you achieve a sense of calm, clarity, relaxation, and this helps your body shift into the healing mode. So I have some of my patients who are having trouble going to sleep, specifically those that have a hard time turning off their mind, to use this deep breathing exercise before they sleep. And it helps them shift from that fight or flight sympathetic nervous system mode of not being able to turn off the brain into the healing mode of the parasympathetic, which slows everything down and gives them that sense of calm and relaxation. And it's amazing how well that works for helping people go to sleep. So next I want to go into essential oil therapy. Essential oil therapy, there are oils which benefit sinuses, lungs, and breathing capacity. Using these oils daily at those times when your breathing is most challenged and on all the right places on the body can make a huge difference in your health. Carry a cotton ball soaked with your favorite essential oil in a baggie. I always put a little note on it so I remember which essential oil is in which baggie. You can carry that with you, and then you just open up the bag and you take a whiff of that oil. And it can give you the medicinal effect of that oil. You can apply oils to the bottom of your feet. And I'm going to show you a spot on the bottom of your feet that is probably the most key spot to bringing breath down through the body and helping your breathing. This is a roll-on. This has essential oil in it. It's a roll-on. And now I'm going to get my foot up here. You see this point right in the center, right below the ball of the foot? It's a dent, okay? That point right there, that's kidney 1. Kidney 1 is the first point of the kidney meridian. It's called the bubbling spring. And anything that you put as far as essential oil or an herb combination on that point is drawn up into the body. Now, when we're trying to use oils to assist breathing, we use specific oils that descend the energy. And so the lung and the kidney meridians are the primary meridians that affect breathing. If you are experiencing qi going up instead of down, we call that counterflow qi. And the symptoms of that are cough, wheezing, shortness of breath. So if you're experiencing counterflow qi, it means that the kidney and the lung need to come down. That energy needs to come down. So if you put essential oils on the bottom of your feet at that kidney 1 point, you can descend the energy to control coughing, wheezing, and shortness of breath. It's just one of the many methods that you can use. The other thing I do is I have this mixture I carry with me. Again, when I mix these, I put a little label on it. I put the date on it. And the mister has blends or oils that you want to use that are medicinal. It would have, in this case, I made one that was a combination of Breathe, which is a blend by doTERRA, and On Guard, which is a blend also by doTERRA. And then wherever you are, you can just spray this. You're in your car, you're in a crowded place, you just spray this around you. This is a great tool and can help open up breathing right away also. This blend that I'm using, the On Guard blend, also another company has a blend called Thieves Oil that's very similar. Both of these have been shown in clinical studies to kill MRSA, which is an antibiotic resistant strain of Staphylococcus bacteria that's very dangerous to people who are immunocompromised. And this essential oil blend also has antiviral capabilities. So this the On Guard or the Thieves blend I use in a diffuser in my work environment in my office. People, I've had people take the diffuser to the hospital room with them if they had to be in the hospital to protect against anything viral or bacterial in their environment that they might be exposed to. So this is one form of diffuser. What this does differently than a vaporizer, for example, is you have a water reservoir, you put drops of the oil that you want to disperse in the water reservoir, and then you set it for the timing. The ultrasonic diffusers actually disperse a fine, cool mist, and it must be an ultrasonic diffuser in order to do this. The vaporizers might have a cool mist, but they don't send out the very fine particles. It's great, but this ultrasonic diffuser is what I use in my for my people in the hospital rooms and in my office. So some of the most effective oils for boosting lung and kidney meridian strength and assist with breathing and to clear toxic heat pathogens are cinnamon, frankincense, rosemary, ginger, peppermint, eucalyptus, white fir. White fir is very strong to descend. That'd be one you put on the bottom of your feet. Tea tree oil, lemon, or the blend Breathe. Oregano oil is a great antiviral oil also, but it must be used with caution because it is caustic to the skin and the mucous membranes. So you would never take oregano oil internally. It could actually cause internal damage. You would only use oregano oil if you were to dilute it significantly. And I've had some amazing experience with oregano oil killing MRSA, topical MRSA, but you have to be very careful to use it very cautiously. Essential oils have different purposes and functions. I am trained in the use of essential oils, and essential oils have a very long history of being used in Oriental medicine. So it's not foreign, it's not like the modern version of our medicine. We've always used essential oils. So regular use of the appropriate essential oils for the person and the condition can be an ongoing healing therapy that you can do for yourself. Some of my patients who have embraced this idea and used essential oils on a daily basis have reported remarkable improvements. One patient with asthma started carrying an essential oil blend called Raven. Raven is very similar to the Breathe blend. And she carried that in her purse right along with her inhaler. I taught her how to take that essential oil blend, and here I've got On Guard, but basically take that blend, put it in the palm, the center of the palm of the hand. You can see that right in the center. And then rub that, cup that over her face. And breathe deeply until she started to feel the throat less tight, the chest less tight, her breathing would ease. And she found that because she carried that right with her in her purse with her inhaler, she now has gone 2 years without using her inhaler. Now, that's not the only thing she's doing, but that's a powerful, powerful tool. If you always carry your rescue inhaler, I'm not saying don't get rid of it, but I'm saying if you have this other tool with you and it works for you, it's so much safer than using a rescue inhaler. So it's worth a try. Even if you're not on an inhaler, this would be a great technique for anybody that experiences shortness of breath or wheezing. Another patient, she had lung sarcoidosis. She had more problems with breathing at night. Therefore, she was not sleeping well, which then created this downward spiral of worsening symptoms. And I suggested that she put the Breathe formula on the bottom of her feet before she went to bed, that kidney 1 point, and then diffuse that same formula from a diffuser on her nightstand, and then turn off the ceiling fan that she had always going over her bed. Now, I don't know which one of those worked. All 3 of them together, probably. But she felt the most miraculous improvement in her breathing, and she started sleeping. And so because she started sleeping, then she started healing. Now, anybody who doesn't sleep well knows that you feel a whole lot better, and you can heal when you're getting sleep. So anything you can do to promote your sleep is going to be very helpful. This became part of her everyday routine. She was doing a lot of other things, herbs and acupuncture and a lot of things, but because she was doing this every day on a regular basis, it really had a great impact. So you may want to study this further on your own or talk to a healthcare practitioner about specific essential oils for you. So now I'm going to go into foods that can help with lung and kidney meridian health. There are many foods that can nourish the lung and kidney meridians. These may be easily added to your diet. Walnuts, for example, are nourishing to the lungs, kidneys, intestines, and brain. Goji berries nourish and moisten the lungs. They're also very good for the eyes. Pears are very nourishing for the lungs, and they just happen to come into season in the fall. One of the things I like to do with pear juice is I crush cardamom seeds and infuse that cardamom into the pear juice. It's a delicious combination, and cardamom also has a medicinal quality to resolve dampness and aid digestion, as well as it soothes the heart. So I love the idea of putting things together that work in combination with one another to give multi-levels of medicinal assistance. Pineapple contains bromelain, which is known to soothe cough and aid digestion. Other warming spices are cinnamon, ginger, cayenne, clove, allspice, and nutmeg. May be added to everyday foods to warm, nourish, and move qi. One person, when they did their introduction, mentioned that she has more trouble when it's cold. And all of us may notice at some time that we have more trouble with any kind of lung problems when it's cold. And so we add these warming spices to assist with that. Another technique would be to use homemade bone broth. It's pretty amazing what bone broth can do. And it's very nourishing for the kidney qi in particular. The preparation of bone broth always begins with excellent quality grass-fed organic beef, buffalo, or oxen bones. Also, an organically grown chicken carcass is a good starter for bone broth. You may use the bone broth to cook your grains or to braise your vegetables, or of course as a soup base. You can just drink it as a cup of tea. So bone broth tastes pretty good in the wintertime. Other home remedies. One technique that's so simple that can ward off a cold or a flu at the very first tickle in your throat is a very simple, inexpensive, and if it works, boy, it will save you a lot of pain, discomfort, and loss of time at work. It can also, really, it can't hurt you either. At the very first sign that you have been exposed to a cold or flu bug, cut a piece of ginger about 1.5 inches, and then you're going to slice that into 5 or 6 slices of ginger, which you add to 2 cups of water, and then you boil that for 5 to 7 minutes. It's a short boil. Short boil's better than a long boil. Then drink this tea and take a hot bath or a shower. Wrap yourself up really well in a blanket and PJs, warm PJs, and go to bed. So you'll sweat, and this is intended. You want to sweat the pathogen out. And then you often wake in the morning without cold or flu symptoms. If you have caught the cold or flu early enough, this works really amazingly well. If the cold or flu advances further, in other words, it beats out our Wei Qi or our protective layer and it goes deeper into the body, then there are other remedies that can work. There are definitely other herbal remedies. And you can give me a call. I can do a telemedicine visit with you and send herbs if that was appropriate. The Chinese have done a lot of recent clinical studies on herbal treatments to successfully treat early stage COVID-19. Now, COVID-19 is not a flu. We know that. But you know what? When it first starts, it acts like a flu. And if we can catch it at its beginning stage, we can beat it. So if it does not progress into the severe acute stages, then that's what we want to achieve. So I've studied this and I've used some of these early stage herbal treatments with success with people. Now, this is a more common thing that comes along, is that non-productive cough, that dry, raspy throat, which I have right now, and I'm going to take a sip here. Because this happens to me when I talk for a while. And this is a great remedy for that dry, raspy throat, sore throat. It's a product called Nimjum Pipagao. And you can actually get this if you're in Albuquerque or Santa Fe at Talent Market. You can also order this online. This is like a cough syrup, but it's an herbal honey infused with herbs cough syrup. It's great for sore throat. It has many of the Chinese herbs that we use when we're treating with herbal remedies for flu and colds. What it does is it soothes the throat, the mucous membranes of the throat. It calms the cough. It breaks up phlegm, causing the cough to become more productive and less frequent. So it does not suppress the cough. You want to add this herbal remedy to hot water for a soothing tea, or take a tablespoon at a time to relieve these symptoms. And I'm going to do that again because my throat's dry. And it's really tasty too. So another herbal, easy to do herbal tea is stash lemon ginger. That is easy to find in the grocery store. It's very soothing for that dry, raspy throat, sore throat. This is not the kind of medicine that I would be prescribing to you through consultation and sending you herbs, but these are things that are available to you for use with yourself and your family. So now for those people who have a really strong tendency to repeated colds and flus that linger for weeks and sometimes turn into really severe conditions. For those who have asthma and use an inhaler. For those who suffer chronic allergies, sinusitis, and bronchitis that occasionally require antibiotic treatment. I encourage you to consider another option for prevention. Acupuncture and herbal treatments have been shown to boost the immune response. When used preventatively, they may eliminate cold and flu susceptibility and lessen the severity or the length of the illness if it occurs. I've seen this time and time again with people. These treatments are very successful in treating asthma, making it possible to reduce or eliminate the use of medications such as inhalers. The progression of chronic lung disease can be slowed or halted and symptoms controlled with ongoing treatments. Lungs that have become damaged by the respiratory disease, by any respiratory disease, may be healed with correct ongoing treatments. So I do a series of treatments that wouldn't be available to you because you're not probably in Grand Junction or Colorado or Moab, Utah. But there are practitioners in your area I would be glad to refer you to. I used to live in New Mexico. I can do the herbal consultations, and I can send you just to someone who would do the acupuncture and the herbs. There are many great practitioners in New Mexico. But I am licensed in New Mexico, Colorado, and Utah. And if you would like to do a telemedicine consultation with me, please feel free to contact me at 970-242-0020 or text to 970-549-6550, or you can email me at Deb, D-E-B, at healthrisingwellness.com. And if you would like a referral for acupuncture, I would be glad to do that. That's my presentation for today. I'm